The code. Blue alarm screamed through Boston Metropolitan Hospital at 2:47 a.m. Blood smeared across white linoleum. Overhead fluorescents buzzed like trapped insects. Doctors and nurses moved in controlled chaos, voices sharp with urgency, hands reaching for equipment monitors, beeping their frantic warnings. In the corner, a mop bucket sat forgotten. Sarah Chen stood beside it, navy janitor scrubs hanging loose on her frame, hands gripping the wooden handle. People brushed past her like she was furniture. Invisible. That's how she preferred it. Move that bucket. You're in the way. Dr. Marcus Webb didn't even look at her as he snapped the order, already turning to bark instructions at a resident. Sarah said nothing. She never did. Just shifted the bucket 6 inches to the left and kept her eyes down. Honestly, why do they let maintenance hang around during traumas? A younger resident muttered to his colleague loud enough for her to hear. Sarah's jaw clenched, almost imperceptible. Her knuckles went white on the mop handle, and for just a second, her hands trembled. Then she forced them still. The ambulance bay doors exploded inward. GSW to the chest. We're losing him fast. Paramedics crashed through, wheeling a gurney at full speed. A man lay strapped to it, mid-30s, Marine Corps tattoo visible on his forearm, blood soaking through the pressure bandages on his chest. The trauma team swarmed, the patient's eyes flickered open. Unfocused, searching. Then they locked onto Sarah's face. Time stopped. His hand shot up, trembling fingers curling into a salute, even as blood seeped through his shirt. His voice came out in a choked gasp. Major Chen. Every person in the ER froze. Dr. Webb spun around. What did he just say? The Marine was trying to sit up now, fighting against the paramedics holding him down, his eyes never leaving Sarah's face. Words tumbled out between ragged breaths. Second MEF. You pulled me from that Humvee in Ramadi. Sarah's mop clattered to the floor. The sound echoed in the sudden silence. Her face had gone completely white, eyes wide with something that looked like terror. Ma'am, Commander. The Marine Sergeant Jake Morrison, according to the name tape on his uniform, was getting stronger instead of weaker, adrenaline overriding blood loss. You saved my life. You have to help them, like you helped us. The monitors erupted into screaming alarms. Blood pressure plummeting, 80/40, then 70/35. A resident fumbled with the IV line, hands shaking badly. I can't find the vein. I can't get the landmarks. 60/30. Sarah backed toward the door, shoulders hitting the wall. Her hands were shaking so violently she had to clench them into fists. 4 years. 4 years of keeping her head down, her mouth shut, her past buried under bleach and mop water. This couldn't be happening. The resident stuck the patient a third time, a fourth. Blood welled from failed attempts. Someone page cardiothoracic. Dr. Webb's voice cracked at the edges. Get me an attending. Get me anyone who knows what they're doing. 50/25. Morrison's hand slipped off the edge of the gurney, fell limp. As his arm swung free, Sarah saw it clearly, the tattoo on his forearm. 2nd Marine Expeditionary Force insignia. Ramadi, 2019. The same ink she'd seen on 100 other Marines. Then the monitor flatlined. One long, endless tone. Before we dive into what happens next, I'd love to know where you're watching from. Drop your city or country in the comments. Are you in Boston? Somewhere else in the States? Overseas? Let me know. No. The word ripped out of Sarah before she could stop it. Dr. Webb grabbed the crash cart, starting compressions. His hands pumped Morrison's chest in a rhythm that was all wrong. Too shallow. Too fast. Wrong placement entirely. Sarah saw it. Saw Morrison's ribs flexing dangerously under Webb's palms. Saw the way his chest caved inward instead of rebounding properly. A flashback hit her like shrapnel. Desert sand in her teeth. The ground shaking from explosions. Her own voice cutting through chaos, steady and sure. Clamp that artery. Move. He's got 30 seconds. Her hands slick with blood that wasn't hers. Sarah blinked. The ER came back into focus. Morrison's hand still hanging off the gurney, still tattooed, still dying. The monitor's flat tone stretched on. Endless. Someone page cardiothoracic. Webb's voice rose higher. Move! Move! The resident took over compressions from Webb, but his technique was even worse. His hands positioned too high on the sternum, pressing down at the wrong angle. Sarah's feet moved before her brain caught up. She shoved past the resident, her hands already reaching for Morrison's chest. Stop! You're compressing wrong. You'll rupture his liver. Dr. Webb whipped around. His face went from pale to red in an instant. Excuse me, security? But Sarah's hands were already on Morrison's fingers, probing his left side with absolute certainty. She could feel it. The tension, the fluid, the blood pooling where it shouldn't be. Intercostal hemorrhage, left side. Her voice came out clinical, detached. He needs a finger thoracostomy. Now. Webb actually laughed. The sound was sharp, disbelieving. A janitor is giving orders in my ER. Sarah didn't look up, didn't look at Webb, didn't look at the resident staring at her like she'd lost her mind. Her eyes stayed on Morrison, on his chest, barely moving, on the monitor still screaming its flat, dead tone. I'm not asking. Her voice changed, dropped an octave, became something else entirely. Scalpel, betadine, chest tube kit, now. This was the voice that had commanded 200 Marines, the voice that had barked orders over gunfire and mortar rounds, the voice she'd buried 4 years ago and sworn she'd never use again. A nurse stepped forward. Older woman, gray hair, pulled back tight, eyes sharp with something that looked like recognition. Elena Santos. Sarah had mopped the floors around her 1,000 times, and Elena had always nodded politely, treating her like a person instead of furniture. Now Elena was looking at her differently, seeing something, knowing something. She handed Sarah a pair of gloves without a word. Sarah snapped them on. Her hands stopped shaking instantly. Muscle memory took over. 4 years of suppression. 4 years of hiding. 4 years of forcing herself to forget. None of it mattered now. Her fingers knew exactly what to do. Had done this 100 times, 200 times, in tents and trenches and the backs of helicopters with rotors screaming overhead. Scalpel. Someone put it in her hand. She didn't see who. The blade went exactly where it needed to go, between the ribs. 5th intercostal space. Perfect angle. Perfect depth. The incision opened clean and deep, exposing the tissue beneath. Rib space located. Her finger went in next. The training came back like she'd never left the field. Finger sweep. Clear the space. Feel for obstructions. Check for lung tissue. Confirm placement. Blood poured out. Not a trickle. A flood. Dark venous blood that had been crushing Morrison's lung, drowning him from the inside. 800 cc's of hemothorax spilling across the trauma bay floor, across Sarah's hands, across the clean tiles she'd mopped just 3 hours ago. The monitor changed pitch. 1 beep. Hesitant. Weak. Then another, blood pressure climbing. 70 over 40. Then 80 over 45. Sarah's hands moved with absolute precision, guiding the resident's shaking fingers. Chest tube. Insert it here, not there. You'll puncture the lung. Here. Follow the tract I made. Gentle. That's it. The resident slid the tube into place, his movements steadier now, following her lead exactly. 90 over 50. Morrison gasped. A real breath. Deep. Ragged. Alive. His eyes fluttered open, confused, but seeing, and the entire ER went silent. No one moved. No one spoke. Even the monitors seemed quieter, their steady beeping a stark contrast to the screaming alarms of 30 seconds ago. Sarah stripped off the gloves and dropped them in the hazard bin. Her hands were perfectly steady now. The tremor that had lived in her fingers for 4 years was gone, burned away by adrenaline and old instincts that refused to die. She looked at Morrison, at his chest rising and falling, at the monitor showing vitals that meant life instead of death. Then she looked at her own hands. These hands had held scalpels in sandstorms, had clamped arteries while bullets pinged off metal walls, had saved lives and lost lives, and carried the weight of every single choice she'd ever made. She'd tried to make them forget, tried to teach them to only grip a mop, to only push a bucket, to only clean up messes that didn't bleed. But they remembered everything. Elena Santos was staring at her with something like awe, something like recognition. One soldier always knows another. That's what her eyes seemed to say. A resident whispered to another, "Did you see that?" Dr. Webb finally found his voice. It came out quieter than before, almost uncertain. "Who are you?" Sarah didn't answer. She turned toward the door, her legs suddenly weak. She needed to leave, needed to get out before anyone asked more questions, before anyone dug deeper, before the past she'd spent 4 years burying clawed its way to the surface and destroyed everything she'd carefully built. But Morrison's voice stopped her. "Thank you, Commander." Sarah closed her eyes. That word, that rank, that life, it was supposed to be dead, supposed to be over, supposed to be something she'd left behind in the desert sand, in the review boards and the congressional hearings that had picked apart every decision she'd ever made. But here it was, alive, breathing, looking at her with gratitude instead of accusation. Sarah's hand found the door handle, cold metal under her palm. 3 more steps and she'd be out. 3 more steps and she could disappear again. Go back to being nobody. Go back to the safety of invisibility. Then the ambulance bay doors burst open again. "Incoming." The EMT's voice cut through the silence like a blade. "Multi-vehicle accident. 3 critical. 2 minutes out." Dr. Webb turned to his staff, his commanding tone returning. "Everyone to stations. Prepare for mass trauma." His eyes found Sarah. Locked on. Held. "You stay." It wasn't a request. Sarah's hand fell from the door handle. Her heart hammered against her ribs. 4 years. 4 years of running. 4 years of hiding behind a mop and bucket. 4 years of pretending she was nobody special. All of it about to be ripped away. Morrison was stable now, unconscious but breathing. The monitors beeped their steady rhythm. Normal sinus. Adequate pressure. Oxygen saturation climbing back to acceptable ranges. Sarah moved toward the door again, slower this time. Dr. Webb stepped into her path. "Who the hell are you?" Sarah's eyes dropped to the floor, to the tile she'd mopped 1,000 times. She said nothing, her jaw clenched so tight her teeth ached. Elena Santos moved closer, her voice quiet but firm. "Those hands. I've seen field surgeons work. Combat medics. That wasn't luck. That was years of training." Sarah still wouldn't look up. Webb opened his mouth to say something else, but the ambulance bay doors crashed open for the second time. The EMTs were already shouting as they barreled through. "Multi-vehicle accident. 3 critical. Teenager with steering column impalement. Middle-aged male with crush injuries. Elderly woman with head trauma." The gurneys rolled past in a blur of blood and chaos. Screaming, crying, the acrid smell of gasoline and burned rubber. Dr. Webb turned back to Sarah. His eyes were sharp, calculating. "You're not going anywhere. If you can actually do what you just did, I need you here, right now." Sarah shook her head. The motion was small, desperate. "I can't. I don't. Not anymore." But Webb was already moving toward the trauma bays, calling out orders. "Get me imaging on the impalement. I need to visualize before I go in blind." Sarah pressed herself against the wall, tried to disappear into it. Her hands found the mop handle she'd left propped in the corner. The wood was smooth under her palms. Familiar. Safe. Not a scalpel. Not a clamp. Not a decision that meant life or death. Just a mop. The teenager was screaming, high and thin and terrified. The steering column had gone through his abdomen, and the preliminary assessment showed a mess of torn tissue and internal bleeding. Dr. Webb stood over him, hands hovering, trying to work out the angle. "I can't see it." His voice was tight with frustration. "There's too much damage. I can't find the bleeder." The vitals monitor showed falling pressure. The numbers dropped steadily, relentlessly. 1 minute passed. 2, 3. Webb tried clamping, tried packing, tried everything he could think of. The teenager's mother was screaming in the hallway. "Please, someone let me see him. Please, let me see my son." 4 minutes. The boy's pressure kept falling. 80 over 50, then 70 over 45. Sarah stood in the corner, her knuckles white on the mop handle. 19 years old. The chart on the wall said his name was Tyler Bennett. Same age as Rodriguez had been. Same terrified eyes. Same desperate need to live. Another flashback hit her. Different ER. Different desert. Different teenager on a different table. Maya Rodriguez, 22 corpsman, bleeding out faster than Sarah could replace the field dressings. "I'm trying," Sarah had said. "I'm trying." But there had been too much damage. Too many injuries. Too little time. Sarah had made the choice. Triaged Rodriguez as expectant. Moved to the lieutenant colonel. Someone she could actually save. Rodriguez had died calling her name. The monitor alarm pulled Sarah back to the present. Tyler Bennett's pressure was critical now. 60 over 30, then 50 over 20. His mother's screams got louder. Sarah's hands released the mop. It clattered to the floor for the second time that night. She moved forward. "It's the subclavian." Her voice cut through the chaos. Every head turned. "You're going dorsal when you need to go ventral. The angle of entry pushed everything forward. You're looking in the wrong place." Dr. Webb spun around. "What?" Sarah was already beside him. "May I?" Webb hesitated. His eyes searched her face. Then he stepped aside. Sarah's fingers moved with absolute certainty. She took the resident's hand and guided it. "Here. Feel that that's the vessel wall. Follow it upstream." The resident's eyes widened. "I feel it." "Good. Not there. You'll nick the artery. Here, gentle pressure. Proximal control first." The resident clamped where she indicated. The bleeding slowed. Stopped. "Now distal." Sarah's voice was steady. Calm. The teaching voice she'd used with 100 combat medics in 100 forward operating bases. "Visualize the anatomy. Don't guess. Know." The bleeder was found. Controlled. Repaired. Tyler Bennett's vitals started climbing. 70 over 40. 80 over 50. Color returning to his face. His eyes opened, confused, frightened, but alive. Dr. Webb was staring at Sarah like he was seeing her for the first time. "Where did you train?" Sarah stripped off the gloves, dropped them in the bin. Her voice came out quiet, measured, each word carefully chosen. "Fort Sam Houston. Advanced Trauma Life Support. Combat Casualty Care." Webb's eyes narrowed. "You're military." The pause stretched out. Long, heavy. Sarah could feel every eye in the ER on her. The residents, the nurses, the techs, all watching, all waiting. "Major." The word tasted like ash in her mouth. "Army Medical Corps, 2nd Marine Expeditionary Force." The ER went silent. Someone dropped an instrument. The clatter echoed. The resident who'd told her to get out of the way earlier turned bright red. His mouth opened and closed. Dr. Webb processed the information slowly, like he couldn't quite believe what he was hearing. You were a combat surgeon with special forces. Field trauma surgeon. Sarah's voice was flat, emotionless. 13 deployments: Iraq, Afghanistan, Syria. Webb repeated the number like he couldn't comprehend it. 13. Sarah didn't respond. She turned back toward the door, back toward escape, back toward the invisibility she'd worked so hard to maintain. But Webb wasn't done. His voice dropped, became quieter, almost gentle. "Why are you mopping floors?" Sarah's face shuddered. "That's not your concern." She took 2 steps toward the exit. The radio on the charge nurse's desk erupted with static. "Dispatch to Boston Metro. Mass casualty event. Factory explosion. 6 critical incoming. ETA 4 minutes. Repeat. 6 critical incoming." The ER erupted into controlled chaos. People moving, equipment being prepared, voices calling out assignments. But underneath it all, Sarah could hear the countdown ticking in her head. 4 minutes until 6 broken bodies crashed through those doors. The hospital administrator appeared in the doorway, a thin man in a suit that cost more than Sarah made in 6 months. His face was pale eyes, scanning the trauma bays already filled with the multi-vehicle accident victims. "Where's Webb?" "Here." Dr. Webb stepped forward, wiping blood from his hands. "We're already running at capacity. We've got 3 criticals from the MVA, 6 more, and we don't have the staff." The administrator's eyes swept the room and landed on Sarah. She was still standing there in her janitor's uniform, blood spattered across the navy blue fabric gloves she'd forgotten to remove still on her hands. "Who's this?" Dr. Webb hesitated. Sarah saw something shift in his expression. A decision being made. Apparently someone who can save lives. We'd lose. The administrator looked from Webb to Sarah and back again. "I don't care if she's a janitor or the Surgeon General. If she can help, she works. We'll sort credentials later." Sarah felt the walls closing in. 4 years. 4 years of hiding. 4 years of anonymity. 4 years of pushing a mop and keeping her head down and pretending she was nobody special. All of it about to be ripped away in front of everyone. "I can't." Her voice came out strangled. "I'm not cleared. I'm not credentialed. I'm not even supposed to be here." The administrator's face hardened. 6 people are going to die in the next hour if we don't have enough hands. You want their deaths on your conscience." He paused, let the words sink in. "Fine, walk out that door. But if you stay, you work." The ambulance sirens were getting louder, closer. Sarah could hear them through the walls now. 2 minutes out, her hands clenched into fists. She could see it playing out already. The chaos, the blood, the impossible choices, the triage decisions that would haunt her for years. Just like before, just like Ramadi, just like the moment that had destroyed her career and her life, and everything she'd believed about herself. Dr. Webb was watching her. Elena Santos was watching her. The residents were watching her. All of them waiting to see what she would do. Tyler Bennett was being wheeled past to imaging the teenager she'd just saved. He caught her eye through the oxygen mask and mouthed 2 words. "Thank you." The sirens were right outside now. 1 minute. Sarah closed her eyes, took 1 breath, 2. When she opened them, something had changed. Some decision made. Some line crossed that couldn't be uncrossed. She stripped off her janitor uniform shirt. Underneath, she wore a plain black tank top sports bra visible at the edges. She rolled up her sleeves, revealing forearms corded with muscle and a small scar on her left shoulder. Shrapnel. Ramadi. "Where do you need me?" Dr. Webb's expression shifted. Relief flooded his features. Respect. Maybe something else. "Trauma Bay 1. Take the lead. I'll back you up." The doors burst open. 6 gurneys. 6 broken bodies. 6 lives hanging by threads. The EMTs were already shouting as they crashed through voices overlapping in desperate urgency. Male 40s crush injuries to chest and abdomen. Female 30s penetrating trauma rebar through the shoulder. Male 50s severe burns, airway compromise. Female 20s traumatic amputation, left leg below the knee. Male 60s head trauma. GCS of 5. Male teens multiple fractures, internal bleeding. Blood trailing across the floor. The smell of burned flesh and diesel fuel and terror. Screaming, crying, monitors shrieking from 6 different directions at once. The residents froze, eyes wide, hands hovering uselessly. Dr. Webb moved between patients, trying to assess, trying to prioritize. His voice rose with each second. I need help here. Someone get me vitals on this one. Where's respiratory? Where's anesthesia? He was losing control. Sarah could see it happening, could see the chaos spiraling. She stood motionless in the center of the storm. Her eyes moved left to right, patient to patient. 10 years of combat medicine taking over, assessing, calculating, prioritizing. Patient 1, crush injuries, distended abdomen, likely liver laceration. Breath sounds diminished on right. Hemothorax. Patient 2, penetrating shoulder trauma but alert and talking. Stable airway. Can wait. Patient 3, burns with stridor. Airways closing. Minutes until he can't breathe. Patient 4, traumatic amputation but tourniquet in place, bleeding controlled. Stable for now. Patient 5, head trauma. Posturing, probable intracranial bleed. Neurosurgery won't save him. Expectant. Patient 16 with rigid abdomen. Likely splenic rupture. Needs surgery but stable enough to wait 30 minutes. 1 breath. 2. Then she opened her mouth and let the command voice out. Listen up. The entire ER stopped. Every head turned. Every conversation died. Even the monitors seemed to quiet their beeping, becoming background instead of foreground. Sarah moved fast. Certain. 10 seconds per patient. Her hands checking pulses. Airways. Bleeding. Her eyes taking in everything. Processing. Deciding. She pointed at the first gurney. Immediate, red tag, needs chest decompression and surgery now. Second gurney. Delayed, yellow tag, stable for transport to OR in 30 minutes. Third gurney. Immediate, red tag, airways compromised, needs intubation immediately or he dies. Fourth gurney. Urgent, orange tag, needs vascular surgery but stable for 20 minutes. Fifth gurney. Her voice didn't waver. Expectant. Black tag. Make him comfortable. Keep family close. Sixth gurney. Urgent. Orange tag. Internal bleeding but stable. Surgery in 30. Her finger stabbed toward the residents. U. Airway management on immediate 3. Get respiratory here now. U. Chest decompression on immediate 1. I'll talk you through it. U. Massive transfusion protocol. Activate it. Now. They moved. Not questioning. Not hesitating. Just moving. Dr. Webb opened his mouth. Wait. We need to discuss treatment plans before we just start making unilateral decisions about care without proper consultation, because this is still my emergency room, and I am still the attending physician on duty tonight, despite whatever rank you may have held in some other context. Sarah turned, looked him dead in the eye. You want to save lives or protect your ego? Choose. The words landed like a slap. Webb's face went red, then white. Then he nodded once, sharp. Sarah turned to the nurses. I need O-negative blood. 4 units per immediate patient. Warming protocol. Someone call the OR. Tell them we're coming up with 3, maybe 4 if we're lucky. Elena Santos was already moving, phone in hand. The ER transformed. The chaos organized itself. Residents found their assignments. Nurses moved with purpose. Equipment appeared where it was needed. IV lines, monitors, medications. Sarah moved between the immediate patients, directing, correcting, teaching even in the middle of crisis. Not like that. Like this. See the angle. Feel the resistance. That's the vessel wall. Don't push through. Gentle. Dr. Webb worked beside her now, not challenging, not questioning, just following the lead of someone who'd done this 1,000 times in places where mistakes meant body bags. The burn victim was first. The resident struggled with the intubation, his hands shaking, the vocal cords swollen and difficult to visualize. "You're going in too steep." Sarah's voice was calm, patient. "Flatten the angle. See it now. There. Tubes in. Inflate the cuff. Check placement." Breath sounds bilateral. Oxygen saturation climbing. One saved. The chest trauma patient was next. Sarah guided the resident's hands. Fifth intercostal space. Mid-axillary line. Feel for the rib. Up and over. Now insert. The needle went in. Air hissed out under pressure. Tension pneumothorax released. Blood pressure stabilized. Two saved. Then Sarah reached the worst case. Male mid-40s name tag said Robert Chen. No relation, but Sarah's stomach twisted anyway. Crushing chest trauma. Both lungs collapsed, internal bleeding, pressure dropping fast. 70/30 and falling. The resident looked up, face pale. "He won't make it upstairs. We'll lose him in the elevator." Sarah's hands were already moving, palpating, assessing. "Then we work here." Dr. Webb stepped closer. "Work here? You mean an emergency thoracotomy in the ER? That's insane. We're not equipped for open chest surgery in a trauma bay. We don't have proper sterile fields and surgical teams and backup plans. If something goes catastrophically wrong." Sarah was already scrubbing, already gloving. Her voice was ice. "I've done this in a tent with mortar rounds incoming. You have walls and lights and a full pharmacy 30 feet away. We're equipped." She picked up the scalpel. "Incision." The blade went through skin, through muscle, between the ribs. Fourth intercostal space. Fast. Precise. No hesitation whatsoever. Blood welled up. Sarah didn't flinch. Rib spreaders. Someone handed them to her. She couldn't see who. Didn't matter. She cranked them open. The chest cavity gaped. Blood everywhere. Pooling, pulsing, dark and red and everywhere. "There." Sarah's finger pointed. "Intercostal artery torn. Clamp." She clamped it herself. The bleeding slowed, but more blood was welling up from deeper. The heart itself was struggling, barely beating, weak, thready. Manual cardiac massage. Her hands wrapped around Robert Chen's heart. The organ felt wrong in her palm. Too soft, too weak, dying. She started squeezing, rhythmic, precise, 30 compressions. Pause, ventilate. The respiratory tech bagged the patient. Rhythm check. The monitor showed a flicker, then a beat. Weak. But there. Another beat. Another. Pressure climbing. 80/40. Sarah's hands kept working, finding bleeders, tying them off, packing damage, doing the impossible with steady fingers and absolute certainty born from doing this exact procedure in far worse conditions. 90/50. The heartbeat grew stronger, steadier. 100/60. Sarah stepped back. "Close him up. Standard thoracotomy closure. You know how to do this." The resident nodded, hands steadier now, following the technique he'd learned in textbooks but never imagined using in an ER. Sarah peeled off her gloves. Her hands were covered in blood up to the elbows. Her black tank top was spattered red. She looked like she'd walked off a battlefield. Maybe she had. The entire ER was watching, silent, stunned, speechless. 2 hours passed. All 6 patients were stabilized. 3 in surgery, 2 in ICU, 1 in recovery. Even the expectant patient, the man with the head trauma, was still alive. Comfortable. His family at his bedside holding his hand saying goodbye properly instead of having him die alone and terrified in a trauma bay. Sarah sat heavily against the wall and slid down until she was on the floor. Knees up, head back, eyes closed. Her hands were shaking now, the adrenaline draining away, leaving nothing but exhaustion and memory and the crushing weight of what she'd just done. Dr. Webb approached slowly, carefully, like approaching a wounded animal that might bolt. That was something I've never seen in my entire career as an emergency physician. His voice was quiet, awed. I honestly don't even have words to adequately describe what just happened here tonight. Sarah's eyes stayed closed. Ramadi, 2019, vehicle convoy ambush. The words started coming. She couldn't stop them. Didn't even try. 17 casualties. 3 hours. No resupply. Her voice broke on the numbers. I lost 4 of them. Silence. Then quieter, including my corpsman, Maya Rodriguez, 22 years old. Sarah opened her eyes, stared at nothing, at the ceiling tiles, at the fluorescent lights that buzzed like insects. She bled out while I was trying to save a lieutenant colonel who'd taken shrapnel to the femoral artery. I made the choice. Triage decision. He had a better chance. The math said, save him. Her voice barely above a whisper now. She died calling for me. I was 30 feet away. Could hear her. Couldn't leave him or he'd bleed out too. So I stayed, finished the procedure, stabilized him. A bitter laugh escaped. Broken. Raw. By the time I got to her, she was gone. Dr. Webb said nothing, just sat down beside her on the floor. Not too close. Respectful distance. Just present. Army investigated, Sarah continued. Said I made the right call. Proper triage protocol. Textbook decision-making. Maximum lives saved. Another broken laugh. Her family didn't see it that way. Media didn't see it that way. Major chooses rank over enlisted. That was the headline. Like I gave a damn about his rank. Like I wasn't trying to save everyone. Like I didn't know all their names, all their stories, all their families waiting back home. Her hands trembled. She pressed them against her knees to stop the shaking. Death threats. Congressional inquiry. They cleared me. Completely. But the damage was done. I couldn't do it anymore. Couldn't make those choices. Couldn't hold a scalpel without seeing her face. So I came here. Took the first job where nobody would ask me to decide who lives and who dies. Where I could just push a mop. Keep my head down. Try to forget. Silence filled the space between them. Then a voice from across the room. Jake Morrison, the Marine from earlier, was awake now, sitting up in his observation bed, being wheeled toward imaging by a nurse. But he stopped them, made them wait. Major Chen never forgot a single Marine. Not one. His voice carried across the ER. Strong, clear. Everyone stopped, turned, listened. She knew all our names, all our hometowns, who had kids, who had wives, who was scared, who was brave. Morrison pointed at Sarah with his unbandaged hand. She took rounds in Ramadi pulling me from that Humvee, took 2 in the shoulder, kept dragging me anyway, didn't stop until I was behind cover. His eyes swept the ER. Found Dr. Webb. Whatever you think you know about triage, about trauma, about combat medicine, she wrote the manual. Literally. It's what they teach at Fort Sam Houston now. The Chen Protocol. Maximum saves under resource-limited conditions. He looked back at Sarah, his eyes fierce, protective. 17 casualties. She saved 13 in 3 hours in hell with no backup, no resupply, no support. 97% save rate across 4 deployments. His voice got louder, stronger. Most combat surgeons are happy with 70%. Sarah's face crumpled. She put her head in her hands, but all she could see was the 3%. All she could hear was Rodriguez calling her name. All she could feel was the weight of every choice she'd ever made, every decision that had meant life for one person and death for another. Elena Santos knelt beside her, put a hand on her shoulder, said nothing. Sometimes there was nothing to say. Just presence, just witness, just understanding. 3 hours later, Sarah was back in the supply closet, back in her janitor uniform. The blue shirt with the name patch she'd removed years ago, the utility pants with bleach stains on the knees. Her mop bucket sat beside her, freshly filled with cleaning solution. Like nothing had happened. Like she hadn't just saved 9 lives in one night. Like she hadn't cracked open a chest in the middle of an ER and held a dying heart in her hands until it remembered how to beat. Sarah was reaching for the door handle when Dr. Webb's voice stopped her. "Wait." Her hand froze on the cold metal. She didn't turn around. The silence stretched. Long enough to hear the ventilation system humming overhead. Long enough to hear someone laughing down the hallway. Long enough to feel the weight of everything unsaid, pressing down like atmosphere. "I owe you an apology." Webb's voice was quiet, careful. "We all do." Sarah still didn't turn. "I saw a janitor. I should have seen a human being. That was inexcusable. The way I spoke to you, the way I dismissed you, that was wrong." He paused. Sarah could hear him shifting his weight. "But more than that, what you did tonight saved 9 lives. We would have lost all of them. Even the expectant case is still breathing. Still, with his family." Sarah's shoulders tensed. "I can't stay. This was a mistake. I shouldn't have gotten involved. I should have walked away." "Was it a mistake?" Webb's voice was closer now. "Because from where I stood, you just reminded yourself of something." "What?" The word came out harsh, defensive. "That you can still save lives. That you're still one of the best trauma surgeons I've ever seen work." Sarah's laugh was bitter. "That I can still make impossible choices. That's not something I wanted to remember." The door opened behind them. Sarah's eyes closed. The hospital administrator walked in. The chief of surgery followed, both of them looking at Sarah with expressions she couldn't read and didn't want to interpret. "Major Chen." The administrator's voice was formal, professional. "Here it comes," Sarah thought. The questions about credentials, about liability, about why she was working as a janitor when she should have disclosed her background, about lawsuits and insurance and all the reasons she couldn't stay. "I've spent the last 3 hours on the phone." Sarah's jaw clenched. Of course he had. "With Walter Reed, with Fort Sam Houston, with your former commanding officer, Colonel Bradford." Sarah's eyes snapped open. The administrator held a tablet scrolling through information. "Your record is extraordinary. Truly extraordinary. I'm sure you also found the investigation," Sarah said flatly. "The congressional inquiry, the headlines. I found a combat surgeon with a 97% save rate under impossible conditions." The administrator looked up. "I found 17 commendations, 4 medals for valor. Testimony from 143 Marines whose lives you saved personally." He scrolled further. "And I found 1 impossible choice that you've been punishing yourself for ever since." The chief of surgery stepped forward, offered a folder. "Trauma attending position. You'd run our emergency surgical program. Build it from the ground up. Train the residents. Develop protocols." Sarah stared at the folder like it might explode. "No triage calls you don't want to make," the administrator said. His voice was gentle now, almost kind. "Full team, peer review, support, counseling, mental health resources, whatever you need." Sarah didn't reach for the folder, didn't move. "I can't. You don't understand. I can't make those decisions anymore." The supply closet door opened again. The resident who'd mocked her earlier stood there, face red, eyes down. "I'm sorry." His voice shook. "For what I said. For how I treated you. For telling security to remove you when you were trying to help." He looked up, met her eyes. Would you teach me what you did tonight? The thoracotomy, the triage, the way you commanded the room, all of it. Other residents appeared behind him, clustering in the doorway. All of us, another one said. Please, we want to learn. Elena Santos pushed through the crowd. Some of us never stop serving Major. We just find new ways, new missions, new teams to lead. Then Jake Morrison appeared, walking slow but steady, an IV pole beside him, but moving under his own power. You told me in Ramadi that every life you saved honored the ones you couldn't. His voice was strong, clear. You still believe that. Sarah felt tears coming, hot, unwanted. She blinked them back hard. I don't know what I believe anymore. Morrison's hand went to his chest, to his heart. Then let us believe it for you, until you remember. Sarah looked at all of them, at Webb, at the administrator, at the chief of surgery, at the residents hungry to learn, at Elena, who recognized a fellow veteran, at Morrison, who wouldn't let her forget who she'd been. Her hand reached out, slow, shaking. She picked up the folder, opened it, read the first page. Trauma Surgery Fellowship Director, teaching position, department head, full authority over emergency protocols and resident education. She looked up at the residents, at the nurses, at Webb, standing there with something like hope in his eyes. I have conditions. The administrator straightened. Name them. Mental health support for staff. Sarah's voice was steady now, certain. Mandatory. No stigma. If we're going to make life and death decisions, we need to be able to process them, talk about them, get help when we need it. The administrator didn't hesitate. Done. Peer review on all triage decisions. No one decides alone. Every critical choice gets reviewed by the team. Discussed. Evaluated. Learned from. Agreed. Sarah took a breath. This one mattered most. And a veteran transition program for combat medics becoming civilians. So no one else has to hide who they are for 4 years. So they know they're valued, that their skills matter, that they belong somewhere. The administrator extended his hand. Deal. When can you start? Sarah looked down at her janitor uniform, at the mop bucket sitting beside her, at the life she'd built out of shame and silence and self-punishment. 4 years of invisibility, 4 years of pretending, 4 years of running from the one thing she was born to do. I need to finish my shift first. A small smile touched her lips, the first real smile in 4 years. Old habits. Dr. Webb actually laughed. It was a good sound. Warm, genuine. I think we can manage without the floors being mopped tonight, Major. Doctor, Sarah corrected quietly. Just Dr. Chen now. Webb nodded. Dr. Chen, welcome to the team. The residents erupted in spontaneous applause. Elena Santos was smiling, tears in her eyes. Morrison gave a sharp nod of approval from his gurney. Sarah stood there holding the folder, surrounded by people who'd seen her at her worst and her best in the span of a single night, and felt something unfamiliar stirring in her chest. Hope. Maybe. Just maybe. The administrator cleared his throat. We'll need to process your credentials. Background check, medical license, verification, hospital privileges. It'll take a few weeks. I understand. In the meantime, you're welcome to observe. Shadow our attendings. Get familiar with our protocols and systems. Sarah nodded. Then she looked at the mop bucket one more time. She'd spent 4 years with that bucket. 4 years hiding behind it. 4 years using it as a shield against a world that had judged her and found her wanting. But she didn't need it anymore. Actually, she said, I think I'll take that teaching offer, if the residents are willing. The youngest resident, the one who'd struggled with the chest tube earlier, stepped forward. When can we start? Tomorrow, Sarah said. 0700, conference room. Bring coffee. We're going to talk about combat triage protocols and why everything you learned in medical school is useless when you've got 17 casualties and 3 hours to save them. The resident's eyes went wide. Yes, ma'am. Doctor, Sarah corrected again, but she was smiling. Webb walked her to the locker room. You know you're going to revolutionize how we do trauma here. Or get fired in a week when administration realizes I have opinions about their protocols. Opinions based on saving lives in war zones. I think we'll manage. He paused at the door. Thank you. For staying. For not walking away. Sarah stripped off the janitor shirt for the last time. Underneath her black tank top was still spattered with blood. Robert Chen's blood. The man whose heart she'd held in her hands. I tried walking away for 4 years, she said quietly. Didn't work. No, Webb agreed. I don't imagine it did. Sarah showered in the staff locker room, watched blood and cleaning solution and 4 years of hiding swirl down the drain. When she emerged, Elena Santos was waiting with a pair of scrubs. Thought you might need these. The janitor uniform doesn't really fit anymore. Sarah took them, navy blue, just like her old uniform shirt, but different, clean, unstained by the past. Thank you. Elena hesitated. Then, I served. Army, 89th Combat Support Hospital, Desert Storm. Sarah looked up. I didn't know. Most people don't. I came home, finished nursing school, and never talked about it. Elena's eyes were knowing, understanding. Took me 10 years to stop flinching at loud noises. 15 before I could sleep through the night. Does it get better? You learn to carry it differently. The weight doesn't go away. You just get stronger. Elena smiled. And having people who understand helps. You're not alone anymore, Sarah. Remember that. Sarah dressed in the scrubs. They fit perfectly. When she looked in the mirror, she barely recognized herself. Not the janitor, not the broken combat surgeon. Something in between. Something new. She found Morrison before she left. He was in recovery stable preparing for transfer to a regular room. Sergeant. He looked up, smiled. Major. Sorry. Doctor. How are you feeling? Like I got shot in the chest, but alive, so I'm not complaining. He sobered. I meant what I said. About Ramadi. About you. Sarah sat in the chair beside his bed. I should have been faster. Getting to you. You were fast enough. I'm here, aren't I? Morrison's voice was firm. You did good work tonight. Rodriguez would be proud. Sarah's throat tightened. You knew her. Different unit, but yeah, everyone knew her. She was good people. He met Sarah's eyes. She wouldn't want you punishing yourself for the rest of your life. You know that, right? Knowing and feeling are different things. Yeah, Morrison nodded. They are, but maybe working here teaching these kids saving lives the right way with support and teams and all that stuff you didn't have in Ramadi. Maybe that helps. A little. Sarah stood. Get some rest, Sergeant. You too, Doctor. She left the hospital at dawn. The sun was rising over Boston, painting the sky in shades of orange and pink. Sarah stood in the parking lot, still wearing the borrowed scrubs, and watched the light spread across the city. 4 years. 4 years of darkness. 4 years of hiding. Maybe it was time to step into the light. 6 months later. The trauma bay at Boston Metropolitan Hospital hummed with controlled energy. 3 residents worked on a gunshot victim, their movements coordinated and confident. 2 nurses managed medications with practiced efficiency. A respiratory therapist adjusted ventilator settings, monitoring oxygen saturation carefully. Dr. Sarah Chen stood at the head of the bed, white coat crisp over navy scrubs. The embroidery on the pocket read, Trauma Surgery Fellowship Director, in neat letters. Her hands were steady as she guided a resident through a chest tube placement. Remember, her voice was calm, patient, the teaching voice she'd honed over 6 months of daily instruction. Every patient is someone's marine, someone's child, someone's reason to keep breathing. The resident nodded, hands steadying as he followed her guidance. The chest tube slid into place smoothly. Perfect angle, perfect depth. Good work, Dr. Patterson. Now secure it and get a post-procedure X-ray to confirm placement. Yes, Dr. Chen. On the wall behind them, a whiteboard showed the statistics Sarah had implemented. Large, bold numbers that told a story. Chen, protocol team-based trauma, triage. Current, save rate, 96% previous hospital average, 71% average response time, 4.2 minutes, 0. Solo triage decisions in 180 days. A younger resident fresh from medical school raised her hand. Dr. Jennifer Kwan, eager, brilliant, reminded Sarah of herself 20 years ago. Dr. Chen, when you're doing combat triage, how do you decide between two patients with similar injuries? Sarah moved to the teaching board. She'd done this lesson 100 times now, but it never got old. This was important. This mattered. You don't decide alone. You assess with your team. You use the data. You trust your training. She drew a quick diagram showing injury severity versus available resources. And you remember that every choice is reviewed, discussed, evaluated, learned from. No one carries that weight solo anymore. Dr. Patterson looked up from securing the chest tube. But what if there's no time for discussion? What if you have to choose right now? Sarah met his eyes. Then you make the best call you can with the information you have. And afterward, you bring it to the team. You process it. You learn from it. You don't bury it and pretend it didn't happen. Her voice softened. Trust me on this one. Burying it doesn't work. The trauma bay doors opened. Sarah looked up, expecting another case, another teaching opportunity. Instead, a veteran walked in. Male, early 30s, wearing a new EMT uniform that still had the creases from the package. His name tag read T. Rodriguez. He carried himself with the unmistakable bearing of former military. Shoulders back, eyes alert. But there was nervousness there too. The uncertainty of someone stepping into a new world. Sarah excused herself from the teaching session and walked over. Extended her hand. Welcome, I'm Dr. Chen. I run the trauma program here. The veteran's eyes widened. Recognition flashed across his face. You're Dr. Sarah Chen. The Dr. Chen. Sarah smiled. She'd gotten used to this reaction over the past 6 months. The Chen protocol had spread beyond Boston Metro. Fort Sam Houston was teaching it. Walter Reed had adopted it. Her name was in journals now, on conference panels. But it still felt strange. That's me. And you are Tommy Rodriguez, former Navy corpsman. This is my first day as an EMT. He hesitated. I learned the Chen protocol at Bethesda. In corpsman training. It's an honor to meet you, ma'am. Rodriguez. The name hit Sarah like a physical blow. She kept her face neutral, professional, but her mind was racing. Rodriguez is a common name, she said carefully. But I have to ask, did you have family who served a sister, maybe? Tommy's face fell. Yeah, Maya. She was a corpsman too. Army. Died in Ramadi in 2019. Sarah's breath caught. I know. I was her commanding officer. The words hung in the air between them. Tommy stared at her. Sarah watched emotions flash across his face. Shock, recognition, and then unexpectedly understanding. You're the one. His voice was quiet, not accusatory, just stating a fact. The one who had to choose. Yes. Silence. Sarah waited for the anger, the accusations, the blame she'd carried for 6 years. Instead, Tommy extended his hand again. Thank you for trying to save her, and thank you for saving the others. Maya wouldn't have wanted you to stop being a doctor because of what happened. Sarah took his hand. Her throat was tight. How do you know that? Because she talked about you all the time, in her letters home, about how you knew everyone's names, how you never asked anyone to do something you wouldn't do yourself, how you were the best trauma surgeon in the Corps. Tommy's grip was firm. She respected you, right up until the end. Tears pricked at Sarah's eyes. She blinked them back. I'm sorry I couldn't save her. I know you tried. That's enough. Tommy smiled. It was sad, but genuine. She'd be proud of what you've built here, this protocol, this program, helping people the way you helped her unit. Dr. Webb appeared at Sarah's shoulder. Dr. Chen, sorry to interrupt, but we've got incoming. Sarah turned grateful for the distraction for the chance to pull herself together. What do we have? Mass casualty, construction accident, 4 critical, ETA 3 minutes. Sarah's training kicked in immediately. The emotion was locked away, compartmentalized for later processing, just like she'd taught her residents to do. How many total? 4 critical, 2 urgent, unknown number of delayed. Sarah's hands were already reaching for gloves. Steady. Sure. No tremor. No hesitation. The shaking that had lived in her fingers for 4 years had never come back. Some wounds healed. Some scars faded. Get me a team. Alert the OR. Activate massive transfusion protocol. She looked at Tommy Rodriguez standing there in his new EMT uniform. Maya's brother, a living connection to the past she'd been running from. You ready for this? Tommy straightened. The nervousness evaporated, replaced by the calm competence of a trained combat medic. Yes, ma'am. Doctor, Sarah corrected, with a small smile. And welcome to Boston Metro. Let's bring them home. The trauma bay transformed. Residents mobilized to their assigned stations. Nurses prepared equipment with practiced efficiency. Elena Santos coordinated with the OR, her voice calm and authoritative over the phone. The entire room moved like a well-oiled machine, like a military unit, like the team Sarah had always wanted but never had in Ramadi. Dr. Webb moved beside her. You've built something special here, Sarah. We've built it, she corrected, together. The ambulance sirens grew louder, closer. Sarah could hear them approaching, that familiar wail that used to make her hands shake and her heart race. Now it just meant work. Purpose, a chance to save lives the right way. With support, with teams, with people who had her back. Dr. Patterson called out, Trauma Bay 1 is clear and prepped. Dr. Kwan added, Bay 2 is ready. I've got the airway cart standing by. Elena Santos appeared at Sarah's elbow. OR is ready for 3. Anesthesia is on standby. Blood bank has 20 units warming. Sarah nodded. Everything in place. Everything ready. The sirens were right outside now. Tommy Rodriguez stood near the door, watching her with an expression she couldn't quite read. Respect, maybe. Understanding. The look of someone who knew what it cost to make impossible choices and keep going anyway. Sarah took one deep breath, centered herself. The ambulance bay doors burst open. 4 gurneys crashed through. Blood, screaming, chaos. The acrid smell of concrete dust and diesel fuel and fear. But this time, Sarah was ready. Her team was ready. The system she'd built was ready. Here we go. Her voice was steady. Command voice, but softer now. Collaborative instead of dictatorial. Talk to me, people. What do we have? The EMTs called out injuries as they wheeled patients in. Multiple traumas, crushing injuries, penetrating wounds, everything terrible and urgent and critical. Sarah's eyes moved across the patients, assessing, calculating, but not alone. Webb your assessment on patient 1. Dr. Webb moved to the first gurney. Male 50s crush injury to pelvis and lower extremities, unstable fracture, probable internal bleeding. Agreed. Patient 2. Dr. Patterson stepped up. Female 40s, penetrating abdominal trauma. Rigid abdomen. Likely splenic rupture. Good catch. Patient 3, and Dr. Kwan was already examining the third patient. Male 30s, head trauma with altered mental status. GCS of 7. Sarah moved between the gurneys, her hands checking, her eyes confirming, her mind processing. But she wasn't making the calls alone, wasn't carrying the weight by herself. Patterson, what's your priority? Patient 2 needs surgery immediately. Unstable abdomen likely bleeding into the peritoneal cavity. I concur. Kwan, patient 3 needs CT and neuroconsult, but he's stable enough for imaging. Webb, patient 1 is critical but can wait 20 minutes if we pack the pelvis and get him typed and crossed. Sarah nodded. Agreed on all counts. Execute. Patterson, your lead on patient 2. I'll assist. Kwan, coordinate with neuro. Webb, stabilize patient 1 and prepare him for OR. They moved. Confident. Coordinated. Each person knowing their role and trusting the others to do theirs. This was what Sarah had envisioned 6 months ago. This was what the Chen protocol was supposed to be. Not one person making impossible choices alone, but a team, working together, supporting each other, saving lives the right way. Dr. Patterson was already prepping patient 2 for emergency surgery. His hands were steady, his movements sure, but Sarah could see the question in his eyes. Talk me through it, she said quietly. What are you thinking? Splenic rupture, probably grade 4 or 5, based on the mechanism and presentation. She needs a splenectomy. Good. What else? Patterson paused. Thought. Check for other injuries. Liver, kidney, pancreas. The impact could have damaged multiple organs. Excellent. You're ready for this. I'll be right beside you, but you've got the skills. Trust your training. Patterson nodded. Some of the tension left his shoulders. They prepped for transport to the OR. Sarah supervised guided taught even in the midst of crisis. This was what she was meant to do. Not just save lives, but teach others to save lives. Pass on the knowledge. Make sure the next generation was better prepared than she had been. Elena Santos appeared with the transport team. OR 3 is ready. Anesthesia is scrubbed in. Good. Let's move. As they wheeled the patient toward the elevator, Sarah caught sight of Tommy Rodriguez. He was helping with patient 4, the one she hadn't assessed yet. His hands moved with the confidence of someone who'd done this before. Combat medic training showing through. He looked up, caught her eye, nodded once. Maya would be proud. The thought hit Sarah unexpectedly. Not with the usual crushing guilt, but with something different. Something lighter. Maybe she would. Maybe all of this, the teaching and the protocol and the team-based approach, maybe this was how Sarah honored the ones she couldn't save. By making sure others could be saved. By making sure no one had to carry the weight alone. By building something better. The elevator doors closed. Sarah turned her attention to Dr. Sar, Patterson and the surgery ahead. There would be time for reflection later. Time for processing. Time for the mandatory counseling session she'd attend tomorrow, just like every member of her team did. But right now, there was work to do. Lives to save. And for the first time in 6 years, Sarah Chen was exactly where she belonged. The surgery took 3 hours. Dr. Patterson's hands were steady throughout his technique, precise and confident. Sarah stood beside him, guiding when necessary, correcting gently, teaching constantly. See that bleeder small but significant. If you don't catch it now, she'll have complications post-op. Patterson clamped it, tied it off. Perfect technique. Good. What else do you see? Splenic artery is intact. Pancreas looks good. No other obvious injuries. Check the mesentery. Impact trauma can cause tears you won't see until they bleed later. Patterson examined carefully. Found a small tear. Repaired it. Sarah stepped back slightly. Let him work. Let him build the confidence that came from doing, not just watching. By the time they closed, Patterson was practically glowing. We did it, he breathed. You did it, Sarah corrected. I just supervised. In recovery, the patient stabilized beautifully. Blood pressure normal. No complications. She'd live. She'd heal. She'd go home to her family. One more life saved. Sarah found Dr. Webb in the attending lounge. He was reviewing charts, but he looked up when she entered. How'd Patterson do? Excellent. He's ready for more complex cases. Webb smiled. You're a good teacher, Sarah. I had good teachers. She poured herself coffee. The break room coffee was terrible, but it was fuel. And I learned from my mistakes. We all do. That's the job. Webb set down his charts. Speaking of which, the board meeting is next week. They want you to present the 6-month outcomes for the Chen protocol. Sarah's stomach tightened. Public speaking. Defending her methods to administrators who'd never held a scalpel in their lives. I'll be ready. You will. The numbers speak for themselves. Webb's voice was firm. 96% save rate. 25% reduction in mortality. Resident satisfaction up 40%. Staff retention at an all-time high. You've transformed this department. We've transformed it, Sarah said quietly. It's not just me. No, but you started it. You built the foundation. Webb stood. Don't sell yourself short. What you've done here matters. Sarah left the hospital that evening as the sun set. The sky was painted in shades of purple and gold. She stood in the parking lot, still in her scrubs, and watched the light fade. 6 months ago, she'd stood in this same spot at dawn watching the sun rise, stepping into the light after 4 years of darkness. Now she was stepping into evening, but it felt different. Not an ending, just a transition, a natural rhythm, light and dark, work and rest, saving and grieving, all of it part of the same cycle. Her phone buzzed, a text from Elena Santos. Veteran Support Group meeting tomorrow, 1800 hours. Tommy Rodriguez is coming. Thought you might want to join. Sarah stared at the message. She'd been avoiding the support group. Attending her mandatory counseling sessions, yes. But the group felt different. More exposed. More vulnerable. But maybe that was the point. She typed back, I'll be there. The next evening, Sarah found herself in a conference room on the 3rd floor. Folding chairs arranged in a circle, coffee and cookies on a side table, a banner on the wall that read, Boston Metro Veterans Support Network. 8 people sat in the circle. Elena Santos, Tommy Rodriguez, 3 nurses, 2 EMTs, and 1 janitor, an older man who'd served in Vietnam. Sarah recognized the janitor, had worked alongside him for 4 years, had never known he was a veteran. How many others had she missed? How many people hiding their service, their trauma, their stories? Elena stood when Sarah entered. Everyone, this is Dr. Sarah Chen. She's joining us tonight. Heads turned. Some people knew her, some didn't. Tommy Rodriguez smiled and gestured to an empty chair beside him. Sarah sat. We're glad you're here, Elena said simply. Then she turned to the group. Who wants to start? One of the nurses spoke first. Air Force, medevac pilot. She talked about the weight of flying wounded soldiers, knowing some wouldn't make it feeling responsible, even though she'd done everything right. Sarah listened, recognized the guilt. The impossible math of triage. The EMT went next. Marine, Afghanistan. He talked about the sounds that still triggered him. Fireworks, car backfires, doors slamming, more recognition, more understanding. When it was Sarah's turn, she hesitated. Then she spoke. My name is Sarah Chen. I was a major in the Army Medical Corps, field trauma surgeon. 13 deployments. The words felt foreign and familiar at the same time. I lost a corpsman named Maya Rodriguez in Ramadi 6 years ago. I made a triage decision, chose to save someone else. The decision was correct according to protocol, but Maya died anyway. Sarah's voice was steady. She'd told this story in counseling, had processed it, had worked through the guilt and shame and anger. But saying it here in front of other veterans felt different, felt like confession and absolution at the same time. I spent 4 years punishing myself, hiding, pretending I was nobody. I mopped floors in the same ER where I now run the trauma program. She looked at Tommy Rodriguez. And 6 months ago, Maya's brother showed up, gave me permission to stop punishing myself, told me Maya would be proud of what I'm building. Tommy nodded. His eyes were bright. I'm learning that healing isn't about forgetting. It's about remembering differently, about honoring the ones we lost by saving the ones we can, by teaching others, by building systems that support instead of destroy. Silence filled the room. Then the Vietnam veteran, the janitor, spoke for the first time. I've worked here 30 years. Never talked about my service. Never let anyone know. His voice was rough with emotion. Watching you these past 6 months, seeing you step into the light, it made me think maybe I could too. He looked around the circle. So thank you for showing us it's possible. After the meeting, Tommy Rodriguez walked Sarah to her car. How are you doing? Sarah asked. Really? Good. The EMT work is challenging. Different from combat medicine, but good, different. He paused. I'm learning to save lives in peacetime. That's something. It is. Can I ask you something? Tommy's voice was careful. Do you still think about her, about Maya? Every day, Sarah said honestly. But it's different now. Before, thinking about her meant drowning in guilt. Now it means remembering someone brave, someone dedicated, someone who died doing what she believed in. She did believe in it, in serving, in helping. Tommy smiled. She used to say that every life saved was a victory against chaos. That's what she called it. Victory against chaos. Sarah felt something shift in her chest. A weight lifting, a burden shared. She was right. 3 months later, the trauma bay was in full swing. Dr. Patterson was running a code. Dr. Kwan was intubating a patient with precision and confidence. Elena Santos coordinated everything with calm authority. Sarah supervised from a distance, stepping in only when needed. Her team had grown, strengthened. They didn't need her constant presence anymore. That was the goal. That was success. Dr. Webb found her reviewing the latest statistics. The board loved your presentation. They want to expand the Chen protocol to the entire hospital. All departments. Sarah looked up. All departments. Oncology, pediatrics, cardiology, everyone. Team-based decision-making, peer review, mental health support. The whole package. That's a lot? It is. Which is why they want to create a new position. Director of Collaborative Medicine. You'd oversee implementation across all services. Sarah sat back. A promotion. More responsibility. More impact. More pressure. I need to think about it. Of course. Take your time. Webb smiled. But for what it's worth, I think you'd be perfect for it. That night, Sarah had her regular counseling session. Dr. Lisa Martinez had been her therapist for 6 months, guiding her through the process of forgiving herself, of rebuilding, of learning to live with the scars instead of being defined by them. They offered me a promotion, Sarah said. How do you feel about that? Terrified, excited, uncertain. Dr. Martinez smiled. That sounds about right. What are you afraid of? Sarah thought about it, really thought. That I'll fail, that I'll let people down, that I'll make another impossible choice and not be able to live with it. Those are valid fears. What else? That I'll succeed, that this will work, that I'll have to keep doing it, keep being responsible, keep making decisions that matter. And that scares you because it means I can't hide anymore. Can't go back to being invisible. Can't pretend I'm just someone who mops floors and keeps her head down. Dr. Martinez leaned forward. Sarah, you were never just someone who mops floors. You were always Dr. Sarah Chen, combat surgeon, teacher, leader. The only person who didn't see that was you. Sarah felt tears coming. She didn't fight them this time, just let them fall. I miss her, she whispered. I miss Maya. I miss all of them, the ones I couldn't save. I know, and you always will, but you're honoring them now. Every life you save, every doctor you train, every protocol you implement. That's your memorial to them. Sarah nodded, wiped her eyes. So what are you going to do about the promotion? Sarah smiled through the tears. I'm going to say yes. 6 weeks later, Sarah stood in front of the entire hospital staff. Department heads, nurses, residents, attendings, technicians, support staff, everyone. The auditorium was packed, standing room only. Sarah wore her white coat. The new embroidery read, Director of Collaborative Medicine. Her hands didn't shake as she approached the podium. Good morning. My name is Dr. Sarah Chen. Some of you know me. Some of you don't. Some of you knew me as the woman who mopped your floors for 4 years. A ripple of recognition went through the crowd. I'm here to talk about a new initiative we're implementing hospital-wide. It's called the Chen Protocol, though I didn't name it that. I would have called it something less pretentious. Scattered laughter. The core principle is simple. No one makes critical decisions alone. Every major choice is reviewed by a team. Every triage decision is discussed. Every difficult case is evaluated collaboratively. Sarah clicked to the next slide. Statistics, numbers, data. In the 9 months since we implemented this in the trauma department, our save rate has increased 25%. Our staff retention is up 40%. Our resident satisfaction scores are the highest in the hospital's history. Another slide. Testimonials from staff, from patients, from families. But more than that, our staff are healthier, happier. They're processing trauma instead of burying it. They're supporting each other instead of suffering alone. They're building careers instead of burning out. Sarah paused, looked out at the sea of faces. I spent 4 years hiding from who I was, punishing myself for decisions I made in war, believing I didn't deserve to practice medicine because I couldn't save everyone. Her voice grew stronger. But I learned something. Healing doesn't come from hiding. It comes from doing the work, from facing the hard choices, from building systems that support us when we stumble. Final slide. A quote. Every life saved is a victory against chaos. Sarah's voice was thick with emotion. A wise corpsman said that. She's gone now, but her words remain. And that's what we're doing here, fighting chaos, saving lives, supporting each other. She looked directly at the audience. This protocol isn't about me. It's about us, all of us, working together. No one alone, no one forgotten, no one left behind. The applause started slowly, then built, then became a standing ovation. Sarah stood at the podium, surrounded by the sound of hands clapping, and felt something she hadn't felt in 6 years. Peace. Not the absence of pain, not the erasure of memory, not the forgetting of loss, but the peace that comes from knowing you're doing what you're meant to do, from honoring the fallen by saving the living, from turning tragedy into purpose. After the presentation, Sarah found herself surrounded by people. Doctors wanting to implement the protocol in their departments. Nurses sharing their own stories of trauma and survival. Residents asking questions about training and technique. Tommy Rodriguez pushed through the crowd. He was in his EMT uniform on break between calls. Maya would be so proud of you, he said quietly. Sarah hugged him. Thank you. For everything, for giving me permission to stop punishing myself. You gave yourself permission. I just reminded you it was an option. Dr. Webb appeared with champagne. To new beginnings. They toasted. Sarah Webb, Elena Tommy Patterson Kwan, and a dozen others who'd become family over the past 9 months. Speech? Someone called. Sarah laughed. I just gave a speech. Another one. A short one. Sarah raised her glass. To teamwork, to support, to never facing the darkness alone, and to Maya Rodriguez and all the others who taught us that every life matters. Every choice counts. Every moment is a chance to make things better. Here, they drank, they celebrated, they shared stories and laughter and the quiet understanding of people who'd been through fire and come out stronger. As the party wound down, Sarah slipped away to the roof. The hospital roof garden was her thinking place, the place she came when she needed clarity. The city spread out below her, Boston at night lights twinkling like stars brought down to earth. Somewhere in those lights people were living, dying, being saved, being lost. And tomorrow, Sarah would be back in the trauma bay, teaching, leading, saving who she could, supporting her team through the ones she couldn't. That was the work. That was the mission. That was the memorial. Her phone buzzed, a text from an unknown number. Dr. Chen, this is Robert Chen. You saved my life 9 months ago. Emergency thoracotomy in the ER. I just wanted to say thank you. I got to walk my daughter down the aisle last week because of you. Sarah's eyes burned with tears, the good kind, the kind that came from joy instead of pain. She typed back, Congratulations! I'm glad you were there for her. Another message came through. This one from Elena. New veteran starting tomorrow. Former Army medic. Nervous. Could you talk to her? Sarah smiled. Of course. Send me her info. The work never stopped. The mission continued. But now, Sarah had a team, had support, had purpose. She looked up at the stars, at the vast darkness punctuated by tiny points of light. Every life saved is a victory against chaos. She whispered to the night, to Maya, to all the ones she couldn't save. I'm fighting for you, for all of you, every single day. The wind carried her words away, and somewhere Sarah liked to think Maya Rodriguez smiled. Sarah Chen walked back into the hospital, past the supply closet where she'd hidden for 4 years, past the trauma bay where she'd reclaimed her identity, past the conference room where broken veterans learned to heal together. She stopped at the elevator. The doors opened. Inside stood a young woman in janitor's uniform, navy blue, name tag removed. The woman's hands were shaking slightly on her mop handle. Sarah recognized that shake, that fear, that desperate need to be invisible. First night? Sarah asked gently. The woman nodded, didn't meet her eyes. It gets better, Sarah said. I promise, and when you're ready, when you want to stop hiding, we'll be here. The door is always open. The woman looked up. Something flickered in her eyes. Hope, maybe. Or just curiosity. Who are you? Sarah smiled. Someone who understands. I'm Dr. Chen. I run the trauma program. And 4 years ago, I wore that same uniform for the same reasons you're wearing it now. The elevator doors started to close. Sarah held them. You don't have to tell me your story. But if you want to, my office is on the 4th floor. Doors always open. No judgment, no pressure, just someone who gets it. The woman's grip on the mop loosened slightly. Thank you. The doors closed. Sarah stood there for a moment. Then she headed to the stairs. She had paperwork to finish, protocols to review, a meeting with the new veteran tomorrow. The work continued. The mission evolved, but the purpose remained constant. Save lives, build teams, honor the fallen by fighting for the living. Every single day. Victory against chaos. That was the work. That was the legacy. That was the memorial. And Sarah Chen was finally, truly home. If this story moved you, if you've ever struggled with impossible choices or hidden your true self because of past trauma, I'd love to hear from you. Drop a comment below about what resonated with you. Have you or someone you know faced similar battles? How did you find your way back? And if you found value in Sarah's journey from darkness to purpose, please hit that like button and subscribe to the channel. There are more stories like this coming, stories about ordinary people doing extraordinary things, about finding redemption in unexpected places, about the courage it takes to step into the light. Share this with someone who needs to hear it. Someone who's hiding, someone who's punishing themselves for past decisions, someone who needs permission to stop running and start healing. Because Sarah's story isn't just about one surgeon, it's about all of us. Every person carrying weight they think they have to carry alone. Every soul believing they don't deserve redemption. Every heart that's forgotten how to hope. You're not alone. The door is open, and healing is possible. Thank you for watching. I'll see you in the next one.